So by definition, there are very few young companies or relatively young companies who have played an impactful role in the history and the legacy of ophthalmology in a continent, Europe in this case. But TEA is definitely one of those companies, and I'm really excited to introduce TEA's president, Jean-Frédéric Gibret, to talk about the company, its amazing history, and the plans for the future and innovation. So welcome, Jean-Frédéric. It's great to see you.
Hello, very happy to see you.
Great. Well, we'll jump right in. We want to hear about your version of TEA's roots, the accomplishments, the plans that you have, as well as your outlook for ophthalmology in general. But first of all, we'd like to hear about you a little bit. Tell us a little bit about yourself, about your background.
So, hello, Joe. Yes, with pleasure. So, I'll tell you a little bit about myself. First, I studied business school in Paris and graduated in 1999. My uncle, Henri Gibret, founded the company TEA in 1994. And I joined TEA in 2000 and worked for 2 years in the Spanish subsidiary in Barcelona, where you are. And I returned to the headquarters in Clermont-Ferrand in 2002. And during these years, I worked in different departments, including finance, innovation, marketing. But then my main focus was really to develop our international expansion in Europe. Yeah. This is the main.
That's great. That's great. Well, the company itself, TEA, is only 26 years old, but it certainly has a much longer history in ophthalmology. And again, it's a luxury. It's great to have a member of the Gibret family here to be able to tell us a little about that. So walk us through a little bit of the history of TEA and more even so about the legacy of your family in eye care in Europe.
So TEA is a relatively young company with a long history. Young company because TEA was founded 26 years ago by my uncle, Henri. And then the long history because as my family has been present in ophthalmology for the last 150 years and 5 generations of ophthalmologists, entrepreneurs, and major companies who have been dedicated to innovation in ophthalmology. So I'll give you a few examples. My great uncle, Paul Gibret, was an ophthalmologist and founded the French Society of Ophthalmology in 1883. My grandfather, Jean, developed the Laboratoire Gibret in the 50s. And there were quite a few achievements at this time. He developed the first antibiotic ointments, streptomycin ointments, the first ocular anti-inflammatories as well, with cortisone, then hydrocortisone, dexamethasone later. He was the first one also to introduce preservatives and impose a shelf life after opening. Now we're trying to remove preservatives, but at the time it was different.
Nice.
And he sold the company to MSD in 1969 because, as he said, he was too big to be a small company and too small to be a big company. So I think this acquisition really enabled MSD to enter the field of ophthalmology and then become a worldwide leader in this market, as you know. So in ophthalmology, so my father developed Biophysique Médicale in 1974 and became a leader really in ophthalmic lasers and ecography until his passing in 1989, and then his company was purchased by Alcon. And then my uncle Henri started TEA in 1994. I joined the company in 2000, and I became president of TEA in 2008, while Henri remains chairman of the holding. And that's it. And so I think we can say that
Extraordinary.
We have
really, it's an extraordinary story to hear. I mean, it's not every day you get to, know somebody that's related actually to having founded the Ophthalmic Society of France. That's extraordinary. Tell us a little bit about Thea today. What's the journey been like? You said you took over the helm, the leadership presidency in 2008. Tell us a little bit about, Thea today, what the journey's been like on these, 13 years since you took the leadership of the company. Has it changed a lot? Is it the size or the focus changed, different areas? Tell us a little bit about how you see it today and how it's changed since you've taken the leadership.
So I think that some things have changed and some not, of course. So maybe what has changed, I think probably the size of the company, of course.
Yeah.
The turnover went from 150 million euros in 2008 to a bit more than 600 million euros in 2020. Probably our international presence as well, as today 75% of our turnover is now done outside France, which was not the case, of course, at the time. And our products are now available in 74 countries today, about 31 direct affiliates and 43 distributors. And probably also our product pipeline, I think, has changed. We developed many products and we entered many ophthalmic domains in the last 13 years. But I think we'll come back on that. I'll come back on that later. But other things have not changed. I think what is important, firstly, that we remain independent and family-owned, allowing really Thea to have a stable ownership and management. I think this is really important. We remain 100% focused on ophthalmology, no diversification outside ophthalmology. Often people ask us, do you want to go outside ophthalmology? No, we remain in ophthalmology. And I think these 2 points, to be independent and to be 100% focused, is really key points, because it really brings us long-term vision, consistency, and really continuity in our strategy in ophthalmology.
Oh, yeah.
And this is really key, especially when I think the landscape in the ophthalmic market has really changed in the last 15, 20 years. Some national companies have lost their patents and abandoned ophthalmology. There were also several mergers, acquisitions, and some companies also which were focused in ophthalmology before lost their focus. And by being integrated in very large and multidisciplinary organization as well. So I think this is really important points. I think really also our philosophy, what is really key is our philosophy to reinvest profits of Thea within the company. This is not always the case when you have other shareholders than when you're on the stock. This really allows us to support our priorities, which are R&D, new products, and international expansion. And what has remained, I think, what is really important is we try to keep the same proximity with our customers and the employees as well. It's really key. It's really key, and we need to visit doctors. We need to be present in the field. And I think all those values, the company is growing, of course, but we really try and we insist on keeping these values.
No, it's amazing to see a company evolve the way certainly Thea has, but to have come at the same time at the essence, to have such a prolonged focus on an area, and to be able to build on something, as the past that you described it makes it so unique. It's an extraordinary company. I've been here in Europe for many, many years now, 30 years, and Thea has obviously been a reference. And most of that time, I've spent a lot of that time in ophthalmology. So extraordinary. It's an amazing. Let's look ahead for a moment. Before looking ahead at the company itself, you certainly know the space well, the ophthalmic space. So having come through, hopefully, these last, say, 15, 18, 20 months of extraordinary circumstances, as we all have with COVID, trying to put that to the side just a little bit, how do you see the prospects of the ophthalmic market in general for the years ahead? Particularly in terms of innovation, what's your view on it? How do you think what the attractiveness of ophthalmology in terms of innovation is?
Not an easy question, but I'll tell you a little bit about some fields which I think can develop. First, I think if we talk about Retina, because most biotechs and big pharma really are, and big pharma companies, they focus their R&D on Retina and or orphan drug diseases like wet AMD, dry AMD, DME, Stargardt, or all those I think diseases. Probably the main reason is that there are still unmet needs, of course, and probably pricing is more attractive in those fields. Big companies are looking for blockbusters, really. And I think even if developments are not easy, because there were really recent failures in phase 3 of different several retina developments in the last years, I think we can expect many innovation in these areas in the coming years in the retina for sure. If we talk another big domain is glaucoma, of course. So I can talk more about the pharmacological approach of glaucoma because there are also other fields. But I think in terms of molecules, I don't think there were major innovations since prostaglandins.
Yeah.
A new class, rokinas, recently came on the market, but I think it's not a real game changer so far. But probably delivery systems and slow release, I think, are new approaches and could be considered trying to improve compliance of patients, of course. And in glaucoma, neuroprotection is really so a new approach, could be a possible approach, but the clinical trials demonstration is quite challenging and can be difficult to prove. But again, I think we can expect some new development in those probably two main areas of ophthalmology today, which are retina and glaucoma. We could talk about
just in terms of qualitatively, would you say then there's exciting times ahead? Pretty positive about how your out view of ophthalmology in general. You see it in a positive outlook, I guess, in terms of innovation.
No, I think there are still other unmet needs, probably blepharitis, inflammation as well.
Yeah.
So I think there's still a lot of course, the eye is a small organ, but with a lot of different approaches, diseases. And I think there are still many unmet needs. Dry eye as well. Dry eye is a big unmet need, and I think there's still a lot to do in innovation in ophthalmology.
So now that you've provided us this, I think a pretty positive view of how you see the market looking, in these areas that are going to be. I think I agree with you. I think those are areas that are really going to be exciting to watch. There are exciting things happening there. Looking at that market, what role do you see they occupying or playing in that space in these coming years?
First, I think we have quite a strong record in innovation in ophthalmology. Today, we offered, I think, a very modern range in ophthalmology. I often say that we developed around 25 innovations in 25 years in nearly all the fields of ophthalmology.
That's amazing.
We were pioneer in developing preservative-free products. We developed the first multi-dose preservative-free bottle in 1994, the ABAC. We were pioneer in eyelid hygiene, ocular nutrition. We also developed the first intracameral antibiotics and mydriasis. So and brought also major advances, I think, in the fields like glaucoma, dry eye, infection. So I think the objective for the coming years is really to try to maintain our leadership by continuing to develop our traditional classes like glaucoma or dry eye, and also enter markets such as retina or orphan drug disease, as we said before, because we are not present in these fields yet. So, and this is the main reason why we created the TEA Open Innovation, to try to enter especially those new domains.
That's great, because that's what anticipating my next question, because I mean, innovation in many ways, has become your second name, and you quite literally made it your second name by creating TEA Open Innovation. Tell us a little bit about that and the reasons behind creating that.
So TEA Open Innovation is it's a sister company of TEA, created in 2019, so it's quite recent. It's a dedicated team, fully dedicated to innovation, and the objective is really to try to put in place collaborations for innovative eye care products developed by universities, by biotechs, or ophthalmologists, to try to really put in place collaborations. And partnerships can be based on development, license agreements, capital investments also. And we try to bring the necessary financial funding to reach the human proof of concept. And we also bring our expertise, I think, in ophthalmology development, meaning our ability to drive clinical development, registration, market access, and all of that.
Right.
And the commercialization then through the TEA structure. And so we worked really through what we call alliance management. Our partners, often they retain their expertise in-house, and they remain leader of their projects, while they can benefit really from our know-how and the expertise and the funding as well. So this is really the objective of the Open Innovation.
That's fantastic. It's funny because open innovation is something that those of us who have been around the industry long enough, and, not just our industry, but we've been hearing it about something that's been on the frontier or something that will be coming sooner or later. And it's interesting to see one of the only organizations that's, really familiar out there that's kind of really made the bet so openly, and in fact, even included in their name is TEA Open Innovation, is this sister company that you've created. So congratulations on that. Well, all eyes will be on to see how that goes and to participate in it, to collaborate with it. So it sounds fantastic. So, as a historic player in the space, everybody certainly knows who you are. The attention of the stakeholders is on you, which is, positive. It adds a little bit of pressure, I presume. But what should we be expecting from TEA in these coming years, in terms of pipeline and strategy, to the extent that you can share with us? What's coming down the pipe? I don't know if there's any new deals or anything you can tell us about, but we'd love to hear it.
Yes, we can mention. Again, the objective is really, as I said, to maintain our innovative leadership by continuing to develop our traditional classes like glaucoma, dry eye, and also trying to enter the retina market. And I can share maybe some examples of concrete and recent deals that we have done in the last 6 months. We partner with a Korean company called Olix, and we signed the first partnership in 2019. And the second one in September last year, and this is in dry and wet AMD. So they have two developments in these fields.
Wow.
We recently signed also a partnership with a Canadian company called Ripple. It's focusing on diabetic macular edema. and it's entering its phase 2 at the moment. And
that's right.
and more recently, beginning of this year, we also signed an agreement with an American company, US company called Nevacar. We got European rights for this development, and it's a low-dose atropine for myopia. So different fields, retina, myopia, and
that's fantastic. What a great breadth, of portfolio for you guys to have promising projects. And that's got to be so motivating for the organization, I mean, especially coming off the time that we've just had, the last, now coming up, we're looking towards the 2-year mark, and by the time we get through this year. So for an organization to have such, promising kind of prospects to look forward to, that has to be fantastic for the team.
Yes, and I could also add that we are really implementing concrete measures to really bring about these ambitions, because we are also our objective really is to double our innovation investment and expenses in the next 5 years. We currently spend around 50 million euros in innovation, and the idea is to bring it to more than 100 million euros per year in 2025. So really, we also recently doubled our lab in Clermont-Ferrand. So yeah, and with the creation of TEA Open Innovation also, we're really trying to give a good move to our innovation.
Good for you. That's fantastic. It's courageous, and it's great for those of us who are in the space. It's encouraging to hear things like that. Just change up for a minute towards internationalization, because as companies expand and grow, there's different components. Obviously, internationalization is one of the big pieces. Talk to us a little bit about, your internationalization, TEA's internationalization rollout, let's call it that way so far. What companies or countries, I should say, or regions are you already present in, and what's ahead in terms of your internationalization?
So it took around 20 years to build and become a leader in Europe. Europe, North Africa, and Sub-Saharan Africa. It took a lot of time, because we need time to build step by step each country, different cultures, and to build credibility. So that took 20 years, and in the last 5 years we entered the Russian market, Ukrainian, Canadian, Mexican. Yeah, we crossed the Atlantic, and the Chilean market as well.
Wow.
And more recently, now the next objective is the US market. I think the first step was 2019, with the creation of our legal entity in Lexington. Plus, we also nominated a general manager, Susan Benton, based in the US.
It's nice to hear. Near my hometown. I'm from Boston, so and I know Susan, so it's great.
Second step was last year we became minority shareholder in a Swiss company called Similazan. They are present in the US, and they have a turnover of around $40 million. And the next step will be to try to develop and register future products to commercialize in the US from 2022, 2023, both in the OTC and the RX markets.
Okay. So that's the next kind of big frontier then, the US
yes,
market.
We will maintain, of course, we want to maintain our leadership and our focus in Europe as well, because it's we come from we are French, we are European, and we don't want to lose this focus. So we will maintain all our efforts in Europe, and we also now want to try to to consolidate. Well, some markets we entered recently, and the US will be the next target and next objective.
Oh, that'd be good. It'd be good to follow the track of that and see how things evolve over the next year or two. That's as lots of companies who've gone that path before, that's a big, ambition. That's a big aspiration, a big heavy lift. So hopefully that'll go well. Just switching around just a little bit. We've talked about strategy and portfolio and innovation, and now about internationalization. Just to switch for a moment about, what some people call the soft stuff, the people thing. What's your view, as you're at the helm of this, the leading organization in Europe and taking on new frontiers like the US and internationalization, but there are components that many do see as softer, like leadership and talent and team development and things like that. What's your take on that? What's your view on that? And is DEA doing anything in particularly specific to address that?
I think when we start a country, there are two key factors for success, really. Great products and great people. So, well, great products, I think, is a basis. We have talked about our innovation pipeline. This is really the basis. But I think great people is as important. You can have the best products if you don't have the right people. It will be a failure. And I think in each country we start, finding the right person is really key. Most of our country managers are local people who know ophthalmology, who know the local market. They are close to doctors and key opinion leaders. Yeah. And this is really, really key. And I think the people we want on board with us, they should have really proximity with their customers. One of the value I mentioned before, they shouldn't be sitting in their offices all day by doing reporting. Yeah. On the contrary, I think they should be in the field, leading by example. This is really, really key to understand unmet needs, to understand ophthalmologist expectations. This is really, really important. Yeah. And so proximity is the first one, and entrepreneurship, I'd say, is also key. Our people are entrepreneurs and are accountable for their decisions and actions. It's really, I think this is really important.
I love that. Hear that from a company
in a family and independent company.
Yeah, exactly. It's great to hear something like that. A company that's on the one hand that's 26 years old, but that has 150 years of legacy behind it. It's almost ironic, and at the same time, it makes good sense. You'd think that an organization like that, a company like that, would be so consolidated that it would almost become functionary. And it's great to hear that as one of the prime components you're looking to seek out and encourage entrepreneurship. That's great. Love to hear that.
Yeah, so better to. I mean, you can make mistakes. You can, but it's better to try to do things, and doesn't matter. I mean, you're accountable and you have to do things.
Good. That's great. So let's jump ahead. Let's imagine that you and I are here in another interview, and the year is 2028, and you're celebrating your 20th anniversary as president of DEA. Imagine we're looking at a successful outcome, a successful portrait of all these years of DEA. As you look at that as a successful portrait, what are you most proud of? Imagine, as I say, we're in 2028 and you're looking at this portrait of what DEA has become, and especially at your tenure of 20 years now of president of DEA. What are you most proud of? What do you feel best about when you look at that portrait of success a few years from now?
I hope, and this is our objective, I think, is to, let's say, to keep our leadership in Europe, in Africa, to be successful in our new countries, especially in America, with Mexico, with Chile, with Canada, with the US, which is our current objective, and also bring new products and innovation in the market. I think this is really the key factors of our growth: new products, innovations, and new countries, and consolidating without forgetting what we have built today.
Yeah. Well, that's great. I mean, it's a shorter time than it seems. So, I look forward to having that interview, maybe with not with the screen in the middle, but sitting together with a nice glass of champagne and celebrating what you've achieved. But congratulations, really, Jean-Frédéric, and all you've achieved so far, you and your team. And it's great to have this chance to talk together. And I look forward to seeing you in person. And in the meantime, best of luck with the remainder of 2021 and the years ahead and all your plans.
Yeah, I hope we can resume traveling soon and that we can meet in person to be much better.
Look forward to it. Merci. Thanks very much. Huh? Take care.
Thank you.
Merci. Bye-bye.